carry on with the next presentation. Please give a very warm welcome to Hemes Nkwa, who is
Voilà, Hemes Nkwa qui est médecin épidémiologiste de terrain, président de Youth for Health and Development of
chairman
Africa,
for
YOHEDA.
Youth for Health in Africa.
Votre présentation, comment
Your
maintenir l'accès à des
presentation
informations
is
de
about
qualité
maintaining
en période de
access
crise.
to
Je vous
quality
laisse la
information in times of crisis. You have the floor.
Vous pouvez, oui.
Thank you very much, Sophie.
Ils sont allumés normalement.
Ok, merci beaucoup Sophie pour la parole.
Thank you so much, Sophie. Ladies and gentlemen, it's a real pleasure for me to be here today. When we received the various emails from Caroline, Victoria, and maybe you think about this anecdote. When I was born, the first gift my dad gave me was Chlorine baby products, and one of my first gifts was also Chlorine products for babies, and so for me it's quite strong. It's very powerful for you to be at the Pierre Fabre Foundation today. So, my job today is to talk about access to quality information in times of crisis, and it's all the more important when maintaining this access, because I heard Frédéric and Béatrice speak earlier on, and I thought, wow, we've got a lot of work ahead of us. Imagine during a deadly epidemic, you have a population that needs information but does not go towards sanitary information, but turns to an influencer or a loved one. You've got to think that this is not true, but this is what actually happens. And it's not an exception. What you see on the screen right now, this is taking place right now in Congo Democratic Republic.
Pardon, là vous avez, durant, il y a de cela quelques années,
so this was a few years ago. I mean, we introduced a vaccine against malaria, and there were a certain number of influencers, an army of influencers producing information and studies to show on the networks that these vaccines were dangerous for children. And unfortunately, this information which propagates, thanks to social networks, has an impact. You can see that the number of vaccine is, the injections are decreasing, and there are research is showing that since 2024, 60 countries were strongly impacted by measles diseases, twice as much than in 2022. And when it comes to malaria in Cameroon, it is one of the first countries who received this vaccine against malaria, and the fact that the population was not prepared upstream left the field open to these influencers in order to feed the population with information claiming that these vaccines destroy children and lead to infertility. In the Congo Democratic Republic, two healthcare professionals recently died. Seems they died because people accuse them of stealing their sex. I don't know if you know this, but in Cameroon we see this more and more. The Coro syndrome and the nocebo effect, and these phenomena are stressed when there is a crisis and on top of it there's the Russian propaganda which is increasing these rumors, which have negative consequences. Now, talking about access to reliable information, it is important to know that there are different types of information, different phenomena that can manipulate or even destroy information. During COVID-19, we saw during the previous panel, this was a global crisis relating many scourges, but there were several problems relating to information that came and altered good information. So you have disinformation, which is this making up news in order to mislead people. And you will get fake news when you have friends sharing tips in group, just to share advice. You know, Chinese doctor said if you take beetroot, you will have less chances to get cancer, or if you take water with a lemon, you won't be, getting COVID. We saw all these different types of messages, and they have an impact on access to good information, and you have all kinds of fake news that can be built and propaganda, which is really important today, especially in Africa with what's happening, considering the current political context. We have the feeling that this is limited to just simple propaganda, but there is also there is not only political propaganda, there's also healthcare propaganda. Now, in crisis situations, disinformation is a silent pathogen agent, more serious than you may think. A study was carried out during COVID-19 because there was this rumor according to which lemon water could cure you from COVID. Now, we mentioned southern countries earlier on, and we didn't have as many cases of casualties than over here. Several reasons were put forward as to why this was the case. But there was a lot of fake information, a lot of rumors, and this rumor on lemon water, which cures or prevents you from catching COVID-19. But when you do fact-checking, so when you check the facts, which is a triangulation between good information, going all the way to the source from this information, contacting the specialists of a given sector, or as you review the literature in the sector, you realize as you produce an article which explains that this is not necessarily true, you get 3 times fewer people impacted by this information. And so with this rumor on lemon water, only 10% of the people got the good information. And this is explained by the fact that when you got a fake news once, it then travels 7 times faster than the good information. And so this is why we would like to stress more on preparing upstream, access to information upstream, so that when later on fake news circulates, the population is already aware and has enough good information in order to make the right decision. And this is all the more serious when you know that there are areas with multiple vulnerabilities. There are areas where the healthcare system is not well developed. You have humanitarian crises, and there is also the digital divide, which may have an impact. Now, as regards the main challenges, there are 3 main challenges. The first one is access. And we had excellent presentations earlier on various technologies, but unfortunately there is a huge digital divide. Over half of the country doesn't even have access to a mobile device, a connected mobile device. So when you set up a certain number of apps, or when you set up digital mechanisms, very few people, especially in rural areas, will have access to this information, will have access to this type of technology. Second challenge is credibility. Access to reliable sources of information. In Cameroon, there is no law guaranteeing access to information. In other words, if you are a media professional and if you want to write an article, or if you want to share with your audience a piece of information, it's difficult to find the right sources, and nobody has to give you this right information. And unfortunately, this feeds into lack of information, and these media professionals sometimes turn towards sources that are less credible. The third challenge is usability. When we have information systems, they're not always adapted understood. And in Africa, there are a certain number of main languages, English, French, Spanish, but these are not necessarily local languages. And when you have solutions in these languages, they don't necessarily make their way down to those who actually need it. And as regards these challenges, there are solutions. So if you take Cameroon, we have the normal information system. There's the sanitary information system where we try and spread information from the community, centrally, internationally, with information feedback. And when there is a specific crisis or public emergency or an extreme situation, there are situation reports that are produced in order to inform healthcare professionals, inform the population, and inform the various media.
Cependant, c'était important
Now,
pour moi de faire ce rappel.
it was important to make this reminder because the idea is not to show what's not working, because there are many things that are fine, that are going well. So this is a photograph taken in 2022 in the north of Cameroon. In the far north of Cameroon, there is currently a crisis. We have the people from Boko Haram making access to primary health care more and more difficult. So a woman died, and she was pregnant, but she had to go to a place 3 or 4 kilometers away from her home, but she died going there. And in order to avoid casualties in the community, we carried out a verbal autopsy in order to understand the situation and avoid this from happening again. And when we do this, we realize that there are many, many problems, but there's so much potential, because in the same region, although it's facing a crisis, the population is very young and there's a high potential, and there are big efforts to electrify the region. And so we don't want to say that everything's going wrong. There is also a lot of hope. YOHEDA, I think Sophie mentioned us earlier on, but we try to contribute, and we have an app called YOHEDA Care, which shares specific information for people with specific problems or difficulties, and we try and connect them to online professionals. We also work a lot on raising awareness, and here we were launching the vaccination campaigns against malaria in Cameroon, and we were working with the children. And we also have a fact-checking site. So when you go online, YOHEDA Healthcare Solutions, you can ask a certain number of questions on rumors circulating, and we carry out checks, and we produce articles, and we say this is the right information. It is also important to remind you who the main target is. I mean, we in this room, we are, let's say, older. I didn't study this precisely, but the main target that we have in terms of access to information is Gen Z. I like this flag, and I'm sure you're all aware of these various revolutions in the world, systemic revolutions in Madagascar, in Kenya, and so on. Of course, we need these solutions to integrate Gen Z, because, of course, we need to fight disinformation with the right codes, with the codes of those consuming the information. And we realize that people of a certain age, of a certain social class, with a certain academic background read the articles. But the younger generation, Gen Z, they are on media, they are on TikTok, they are on YouTube. You need to produce basic content for them. They won't read scientific papers or articles. And so you need to keep it as simple as possible for this generation to use them, to read them. And you need to integrate them in researching solutions, because otherwise you have the feeling that you come up with a solution with a person who just couldn't care about it, and you will just be worsening the situation. And with this situation, the reaction can be very, very brutal. And so there are a certain number of solutions when we mention making information available, we have a certain number of universities, such as Stanford, who are working on how to combat misinformation through evidence-based health videos. The WHO also created a network which shares quality information, which encourages all these players along those lines. And a few months ago, we also worked with an organization called Science Presse, and the International Organization of the Francophonie has published a number of classes in order to improve medical literacy and inform non-professionals. Now, if you want to remember something from this presentation, it wasn't too long, I hope, is that quality information is not luxury. It is truly part of healthcare, especially for southern countries, because if you get quality information, you can save lives, and so it must become a healthcare policy, and this is what we are advocating for. And I'd like to finish with this quote from Bernard Kouchner. I think everyone in the humanitarian world knows him. Information and humanitarianism are the remedy against extreme pain. So we need to think about this. We need to think about our populations, our planet, and the generations to come. And we need to think about how we can put an end for extreme pain. And to do this, we need quality information. Thank you very much for your information. Do not hesitate to write to us if you have any question. Thank you very much.